Tonsils and adenoids. This is a thing that is talked about a lot, particularly when in relation to children and when children are sick in our country and around the world. Hi, my name is Dr. Wahome Karanja. I'm a consultant ENT, rhinology and skull-base surgeon, working in Nairobi, Kenya, in Prodigy ear, nose and throat and clinic here in Upperhill. Now, tonsils and adenoids are a bunch of tissues that are found within the throat and behind the nose. They are what you call lymphoid tissues, and we are all born with them. And lymphoid tissues are necessary and important, especially in the first few years of life, in terms of immunity and immune function to help us to fight infections. If you look at the back of the throat, you will be able to see just around and surrounding where you find that small moving thing at the end of the palate called an uvula. You'll find a band of tissue. Some of these are small, some are big, some may have an infection or have some yellow discoloration around them. These are what you call palatine tonsils. Now, right behind that uvula, in the area of the back of the nose, you also have similar lymphoid tissues, and these are what are called adenoids. Now, adenoids and tonsils are a bigger problem in children than they are in adults, because that is also the time when we are tackling infections. The disease of these two areas is also correlated with pre and school early childhood learning because of interaction with children, infections, and so on. And their problems are almost always increased when children open school in the first 2 to 3 weeks after opening school. Now, adenoids and tonsils are very important, as I have said, in terms of immune function, but they are also can become enlarged. What causes this enlargement? Oftentimes it could be from allergies. And in terms of allergies, you have children with coexisting symptoms of sneezing, itchiness, running nose, and so on. And what we tend to do is to keep them warm, avoid the things that cause these episodes of allergic responses like dust, exposure to pollens, and around the environment where we can be able to manage, for example, at home, to be able to minimize this. So reduce the amount of dust, use the right and correct beddings, keep your house dry and dust free as much as possible. And these are things that can be able to help in reducing the enlargement. By and large, people with enlarged adenoids and tonsils do not have symptoms, but there's still a significant group that does. And when they have symptoms, then particularly they would have problems with sleep. So you can have children having snoring, which is unusual in children. Children are what you call obligate nose breathers. They are supposed to be able to only breathe comfortably through their nose. So when they are forced to mouth breathe, then at their time of sleep or even during wake times, you can find that they are snoring when the adenoids are enlarged. And if you have snoring that is related to what is called obstructive apnea, which means that they're having pausing in breath when they are snoring loudly, then this is a sign that you need to take action as a parent. Tonsils, on the other hand, can also be involved in terms of enlargement, and therefore can give you difficulty not just in snoring but even in swallowing and even in abnormality of speech. Because the adenoids and tonsils are related with tissues other than themselves, you will not just have problems with breathing and snoring, you could have a backflow problem towards the ears where you can have reduced hearing because of fluid accumulating in the ears, and this can interfere with learning in preschoolers and early childhood schooling when they're not hearing well, and this can actually affect school performance. What happens when you have these symptoms and you actually have the complications of adenoid and tonsil enlargement is, because of recurrent infections, you can be overusing antibiotics. The overuse of antibiotics can obviously lead to complications from the antibiotics themselves. The recurrent infections of the tonsils can also lead to the risk of heart, kidney disease, and other complications, and can also lead to things like rheumatic fever and rheumatic heart disease. So when you have a child having the recurrent infections of more than 6 episodes in a year, or more than 4 episodes in each year of 2 consecutive years, or more than 2 episodes in 4 consecutive years, then you need to have a look by the ear, nose and throat specialists. Majority are treatable with, for example, if you have allergic cause, nasal sprays, antihistamine medications which are taken orally. But for those that persist, so you have a child who continues to snore despite the treatment that you give, and a child who is getting recurrent tonsillitis despite the number of times that you're giving antibiotics, you may need to consider surgery. And the surgery for adenoids and tonsils is called either adenoidectomy, which means removal of the adenoids alone. But if the tonsils are also involved, either in excessive size where they are occupying enough space and therefore contributing to abnormality in terms of speech and swallowing, or recurrence of the infections of the tonsils, then you also can have a tonsillectomy. Now, many times, or oftentimes, you have what is called an adenotonsillectomy, or a removal of both tissues. This is a major operation, but fairly safe. We do thousands of adenotonsillectomies every year in leading hospitals here and around the country, and it's fairly safe in the right hands. And we're happy to see you, we're happy to see your child if you're having some of these symptoms listed, and we are also happy to take you through the journey of recovery, so that then your child can be able to have good learning experience, a good growth and physical development, and a fantastic life ahead of them, devoid of the negative effects of enlarged adenoids and tonsils. Thank you, and catch up for more information that might be useful in helping your child grow and develop. Asante.